Imagine starting your morning with something so simple. It takes less than 10 minutes, requires no equipment, and yet directly improves your circulation, joint mobility, balance, and energy for the entire day. Not later in the day, not after effort, right from the moment you wake up. This is the habit. Structured 5 to 10 minute morning activation routine done immediately after getting out of bed. Not exercise in the traditional sense, not a workout, but a sequence of small specific movements that wake up your body in the correct order. And here's why this matters so much after 50. When you sleep, your body becomes still for hours. Circulation slows, joints stiffen, muscles tighten slightly, and your nervous system shifts into a low activity state. So when you wake up and go straight into your day, walking, bending, lifting, you're asking your body to perform without preparation. That's when small strains happen. That's when balance feels off. That's when stiffness lingers longer than it should. But when you activate your body properly first, everything changes. Now the first question most people have is, what exactly should I do? Here's the structure. The routine has 3 simple phases: circulation, mobility, activation, and it must be done in that order. Because if you skip the order, you reduce the benefit. Let's start with the first phase, circulation. Before you even think about stretching or moving deeply, your goal is simple. Get your blood moving. You can do this standing beside your bed, slow marching in place, gentle arm swings, light ankle rotations, nothing intense, just enough to gradually increase your heart rate and signal your body that the day has begun. This should take about 2 minutes. And here's what most people do wrong. They skip this completely. They go straight into stretching, or worse, they rush into activity. But without circulation first, your muscles are still cold, your joints are still stiff, and your body isn't ready. Now once circulation is active, you move into the second phase, mobility. This is where you gently take your joints through their natural range of motion. Neck turns, shoulder rolls, hip circles, knee bends, ankle movements. And here's the key: slow and controlled. Not forced, not aggressive. You're not trying to push limits. You're reminding your joints how to move. Now imagine this. You wake up and your hips feel tight. Your back feels stiff. Instead of ignoring it, you move through it slowly. Within a few minutes, that stiffness begins to ease. Not disappear completely, but reduce enough that your movement feels smoother. That's mobility doing its job. Now here's a mistake that causes problems. People try to stretch too deeply, too early. They feel stiffness and immediately try to force flexibility. But tight muscles in the morning are not ready for deep stretching, and forcing them increases the risk of strain. So the rule here is simple. Gentle motion first, deeper movement later in the day if needed. Now we move into the third phase, activation. This is where you lightly engage your muscles, not to fatigue them, but to wake them up. Simple movements like standing calf raises, light squats to a chair, gentle arm presses. Nothing extreme, just enough to tell your muscles you're about to be used. And this phase is what prepares your body for balance, walking, and daily tasks. Now here's what happens when all 3 phases are done correctly. Within 5 to 10 minutes, your body shifts from stiff and slow to ready and responsive. Your steps feel more stable. Your posture improves. Your energy feels more natural, not forced. And this effect carries into the rest of your day. Now let me ask you something. When you wake up, do you give your body time to prepare, or do you go straight into activity? Because that decision repeats every single day. And over time, it either protects your body or gradually wears it down. Now here's something most people don't expect. This routine doesn't just prevent problems. It reveals them early. If something feels unusually stiff, if one side feels weaker, if balance feels slightly off, you notice it immediately. And that awareness allows you to respond early, before it becomes a bigger issue. Now let's talk about timelines, because this is where people either stay consistent or stop too early. In the first few days, you may simply feel looser. Movement feels easier, less resistance. By the end of the first week, many people notice improved stability, especially when walking or standing. By the second week, something subtle but important happens. You start needing the routine less to feel normal, because your body begins adapting. And here's where people make a mistake. They think, I feel fine now, I don't need to do it, and they stop. But the improvement didn't come from nowhere, it came from the routine. And when the routine stops, the stiffness slowly returns. Now here's another overlooked benefit. This habit improves your confidence in movement. You feel more secure walking, more stable standing, less hesitant when bending or turning. And that confidence reduces the risk of falls, not because you're being careful, but because your body is better prepared. Now let's talk about who benefits the most from this. If you wake up feeling stiff, if your first few steps feel slow or uncomfortable, if you've noticed a slight decline in balance or flexibility, this routine is exactly what your body needs. On the other hand, if you already have significant pain, joint injury, or severe mobility limitations, you need to modify this approach. Smaller movements, more support, possibly guidance, because the goal is activation without strain. Now here's a question many people ask at this point. What if I don't have time in the morning? And the answer is simple. You don't need extra time. You need better use of the first few minutes you already have, because this replaces rushing. It replaces stiffness. It replaces that slow, uncomfortable start to the day. Now imagine this. Two people wake up at the same time. One gets up and immediately starts their day. The other spends 7 minutes activating their body. By midday, the difference is noticeable. One feels slightly tight, slightly fatigued. The other feels more fluid, more stable, more in control. And that difference repeats daily. Now here's something even deeper. This habit creates a signal for your brain, a pattern that says the day has started, the body is active, and that signal influences everything from posture to energy to focus. But there's one more detail, small, almost invisible, that determines whether this routine stays effective over time, or slowly loses its impact without you realizing it. And most people don't notice it until their progress stops. It's the speed at which you move through the routine. Most people either rush through it or move so slowly that there's no real activation. And both approaches reduce the effect, because your body responds best to controlled, deliberate movement with a steady rhythm, not hurried, not sluggish. There's a natural pace where each movement flows into the next, where your breathing stays steady and your body gradually builds readiness. And when you find that pace, something interesting happens. The routine stops feeling like something you have to do and starts feeling like something your body expects. Now here's a hidden mistake that often appears after the first couple of weeks. People stop paying attention to how their body feels during the routine. They go on autopilot. Same movements, same sequence, no awareness. And when awareness disappears, small changes go unnoticed. Tightness on one side, reduced range in a joint, slight imbalance. These are signals. And this routine is one of the few moments in your day where you can actually catch them early. So instead of just going through the motions, you check in, you notice, you adjust. Now let's go a level deeper into something most people don't realize. The order of muscle activation matters more than the movements themselves. If your lower body activates before your core is engaged, your stability is reduced. If your shoulders move before your upper back is active, your posture compensates. So a simple shift, like lightly engaging your core before standing movements, can completely change how stable you feel. Now here's how you apply that practically. Before you begin your activation phase, you pause for a moment. You stand upright. You gently tighten your midsection, not forcefully, just enough to feel support. Then you move. That one adjustment often makes movements feel smoother, more controlled, and more balanced. Now here's another overlooked factor: foot contact. How your feet interact with the ground during this routine affects everything above it. If your weight stays on your heels, your movement becomes limited. If it shifts too far forward, balance becomes unstable. But when your weight is evenly distributed across your feet, your body moves more efficiently. So even something as simple as a calf raise becomes more effective when your footing is correct. Now let's talk about progression, because this routine should not stay exactly the same forever. After about 3 to 4 weeks of consistency, your body adapts. The same movements feel easier, less effort, less challenge. And this is where people unknowingly plateau. So instead of adding intensity, you add variation. Slightly deeper range of motion, slightly longer holds, slightly more control, not more force, just more intention. And that keeps your body responding without increasing risk. Now here's an important distinction. This routine is not designed to exhaust you. If you feel tired afterward, you've likely done too much. The goal is to feel more capable, not depleted. And that's where many people misinterpret effort. They think more effort equals better results. But in this case, better results come from precision and consistency. Now let's talk about a group of people who often struggle with this routine, even though they need it the most. Those who wake up with noticeable stiffness or mild pain. Their instinct is to avoid movement, to wait until the body loosens up on its own. But without gentle activation, that stiffness often lingers longer. So the key here is starting smaller, shorter range, slower pace, even seated movements if necessary, because movement, even minimal, is what begins the release. On the other hand, there's also a group that needs to be careful in a different way. Those who feel good and push too far too soon. They add extra repetitions. They move faster. They try to turn this into a workout, and that's when small strains can appear, especially in the lower back, knees, or shoulders. So staying within the purpose of the routine is critical. Activation, not exertion. Now here's a timeline most people don't expect. Around the 4th or 5th week, the biggest benefit is no longer physical. It's behavioral. You begin starting your day differently, with intention instead of reaction. And that shift influences everything that follows. You move more consciously. You notice posture more. You respond to stiffness earlier instead of ignoring it. And over time, those small decisions accumulate. Now here's an overlooked warning sign that appears if something isn't working correctly. If one side of your body consistently feels tighter, weaker, or less responsive during the routine, that imbalance should not be ignored, because your body is compensating somewhere, and early detection here can prevent larger issues later. Sometimes the solution is simple: slowing down on that side, reducing range, focusing more attention, but the key is noticing it early. Now let me ask you something. When you finish your morning routine, do you feel more stable than when you started, or do you feel the same? Because that difference tells you whether your routine is actually working. Now here's something deeper that most people only realize after staying consistent for a while. This routine doesn't just prepare your body for the day. It changes how your body responds to the entire day. Walking feels easier. Standing feels more natural. Transitions, like sitting to standing, become smoother. And those are the exact movements that determine independence over time. But there's one more subtle factor, often completely ignored, that determines whether these improvements continue or slowly fade, even if you stay consistent. And it has nothing to do with the routine itself. It has to do with what you do in the first 30 minutes after you finish.